Hi, my name is Lois Brand and I'm at Pembroke College where I'm the lead for the clinical students. In this short presentation, I'm going to tell you a little bit about what Pembroke has to offer medical students in Oxford. So, what are the advantages for medics of the college system? Well, colleges are small. We have just 4 medical students in each year group out of a total of about 100 students doing other subjects. This means that your best friends at university are unlikely to be other medics, but more likely to be students studying a wide range of other subjects, which makes for a healthy and interesting social life. Colleges also provide a wealth of non-academic opportunities, sporting, musical and cultural. And here are some examples of some of the things that Pembroke medics from recent years have got up to. The JCR, i.e. the students, own a fantastic art collection, and this is Megan, who's one of the curators who organises that art collection. The college has a rich musical life. The students put on regular musical recitals and productions. We have an amazing summer internship scheme. You can see here Ebu in Brazil holding a snake, and Duha surrounded by an excited bunch of schoolchildren in Nepal. Dan and Harriet went to Japan on the Technos trip, which is an all-expenses-paid cultural trip to Japan. There's a lot of sport that goes on at Pembroke. You can see here Sam and Lalu playing rugby for the college, and Ebu on the netball team. She also played for the university. Mo's a bit of a football superstar and played for both Pembroke and for the university. And then there's the rowing. We have a strong heritage at Pembroke, and the medics take part in that. So here we have Rihanna, Anastasia and Flo, who are all GB rowers. Sadly, Anastasia has just missed out on going to the Olympics in Tokyo. And then we have academic events, with past college members coming back to give inspiring talks. So, for example, Lord Peter Ricketts gave a talk in college last year. He's the ex-head of the Foreign Office. And we're hoping that in the near future, Chris Whitty, the Chief Medical Officer, who's also a Pembroke medic, will come back and talk about his experiences during the pandemic. At Pembroke, we have some amazing tutors to look after you in both your preclinical and clinical years. Professor Frederick Carpe leads the preclinical course at Pembroke and is a world expert on lipid metabolism. He's joined by a strong team in biochemistry. Here we see Catherine Pinnock, who works with Frederick in lipids, Andre Ferger, who's an expert in molecular biology, and Anna Duncan, who's a structural biochemist. Rob Hatch, an intensive care doctor, and Oliver Ryder, a cardiologist, are involved with tutoring in phys and pharm. Richard Colling is a pathologist and teaches in the second year of the course. And Ed Mitchell is a forensic psychiatrist and teaches psychology. On the clinical course, we again have a wide range of tutors involved in your teaching. Dr. Richard Harrington is a GP and is also Deputy Director of the Graduate Entry Medicine Programme. I'm a consultant in emergency medicine and also Associate Director of the Clinical School. We work with a great range of clinical tutors covering many different specialties. We also got a strong team of pastoral support for you throughout the preclinical and clinical years. This is what college tutorials can look like. So the one on the top right there, that's a preclinical tutorial. It's actually a graduate entry tutorial, but gives you an idea of how small, personal and often informal these tutorials are. On the bottom left, you'll see a tutorial which is happening outside of college. And in your third year, you will choose a research project and you will be tutored by somebody who is expert in that field within the medical sciences division. On the bottom right, you see a clinical tutorial where we're working with a dummy, a simulation patient, learning how to manage acute medical and surgical emergencies. There are many opportunities to win prizes, scholarships and awards within college, and here are just some examples of that. So I hope that I've convinced you that Pembroke is a wonderful place to launch your medical career. And thanks for watching.